Hey, y'all, it's Michelle with SLP Full Disclosure. Thank y'all so much for joining us today. We have a super exciting topic and one that's very specific and one that I am really excited to learn more about. Today, we are going to be talking about apraxia of speech. Apraxia is something that's often misunderstood, and when it's diagnosed, it leaves families with lots of questions about what it means, how it's diagnosed, and most importantly, what they can do to help their children find their voices. And that is why I am so excited to be joined by Laura Smith. So, Laura, welcome to the podcast. Let me say welcome back to the podcast. So, this is your second appearance on SLP Full Disclosure.
Yeah, thanks, Michelle. Thanks for having me.
Oh, I'm so excited to talk to you because apraxia is something that I feel like is so specialized and it's such a little niche inside of speech language pathology, which there are a million different niches in our field,
Oh,
right?
yes.
But I'm super excited to have you back on this show today and get your expertise on apraxia of speech. So,
Yeah.
welcome back. So, let me tell you guys a little bit about Laura. Laura is a speech language pathologist specializing in childhood apraxia of speech. Her advocacy work for apraxia awareness has taken her into starting her own private practice, a mile high speech therapy, authoring the book Overcoming Apraxia, lecturing on apraxia, and spreading awareness via her various social media outlets under the handle SLP Mommy of Apraxia, which I will say, that is how I found you.
Yeah, on TikTok though, right?
I did. I found you on TikTok and I was like, oh my gosh, you came on my page and I just started watching all of your videos just over and over. And I was like, I have to have her on the podcast. So, Laura, the first question I want to ask you in your own words, as a specialist in apraxia of speech, how would you define apraxia in a way that parents, educators, and SLPs can understand?
So, I mean, I have to start with the technical definition first, just because we have it
Okay.
from ASHA. So, basically, the ASHA says it's difficulty planning and programming the movements for speech. So, when we think about apraxia as opposed to our other speech sound disorders, apraxia starts in the brain. The brain is what is planning the movements when we're talking. It's planning the parameters of what we're saying. And so it really starts in there. And I would say for the easiest way for people to understand that I've seen it described by multiple people who have apraxia themselves is that there is a disconnect between the brain and the mouth. So that would be
Um,
your easy definition.
okay, so a disconnect between the brain and the mouth. So the brain knows what it wants to say. The brain has the words. The brain knows exactly what it wants to do, but the mouth is not connected to the brain. And so when the words come out, or when you try to say the words are just not coming out, or they come out incorrectly, right?
Correct. Yeah, I would say that was the easiest way to describe it to someone who doesn't really know.
Yeah. Why is apraxia so scary to parents? When they hear that word, why is it so frightening?
Well, one reason can be Google. So if you, as an SLP, don't send your families to credible information, or a
Mhm.
website or resources that are credible, you'll Google it, and the first thing that a lot of times the first thing that comes up would be acquired apraxia of speech in adults. And the way you get acquired apraxia of speech is through stroke, TBI, some sort of brain
Mhm.
injury, and so parents see that and could potentially freak out.
Right.
And not all parents freak out at first. Some don't know what it is. They're like, "Oh, okay, yeah, just treat them or whatever." But I would say that's the biggest problem is when parents go to a search engine and then find information that's not relevant to their case. However, after that, once they find information relevant to their case and they're reading up about it, apraxia, if a child truly has childhood apraxia of speech, it is a lifelong neurological disorder. And so just the fact that that word lifelong is in there makes you question, "Oh my gosh, like, are they ever gonna be able to talk? If they talk, can they talk
Mhm.
clearly? Are they gonna be successful? Will they hold down a job?" Like, it's so crazy because when I was an SLP in the schools, for example, I had a supervisor who was always telling me before, and because I was an SLPA before I was an SLP, and I had a supervisor before we went into meetings always tell me, "Remember, Laura, this is someone's baby." And she
Yep.
didn't elaborate, and I didn't have children at that time, and after the
Mhm.
20th or whatever time, I'm like, "Why does she always say this to me?" Like, I know this is someone's baby. But only until it really happened to me is when I realized as a school SLP, those IEP meetings were great. You go in there, we rocked the goals, you get to tell the parents we met
Mhm.
these goals, here are our new goals. I'm just thinking year to year. Parents are
Right.
thinking adulthood and life.
They're thinking
Yeah.
they're thinking forever.
Yep,
You're right.
exactly.
How would you say apraxia is different from other speech disorders? Your articulation disorders, your phonological disorders? I know that we talked about that disconnect in the brain, but a lot of times they can present very similarly,
Oh,
correct?
yes, because you can have someone who looks severely unintelligible, particularly with, severe phonological disorder. And if you're
Mhm,
just, listening to them talk, it's not going necessarily to be readily apparent that, oh, that one's apraxia, that one's severe phonological disorder. So,
mhm.
really, the biggest difference comes down to your motor speech exam, your diagnostics. So, really important to do what's called a motor speech exam because the difference with apraxia as opposed to all other speech sound disorders is that it is a motor planning. It's difficulty planning and programming the movements for speech, and those characteristics will show up in a motor speech exam.
What motor speech exam do you use? Do you have a specific one that you use?
So I was trained in an informal motor speech by these international experts. I went to this training for 3 days, and so they just taught me how to do one, but now we do have formal ones, like the DEMS is out there. People don't find the DEMS to be particularly user-friendly. The VimPack is one that I know a lot of school SLPs have used with my daughter. I personally have not used that one, but everyone who's used it has found it pretty friendly. And you can link those, like, in your comments too or whatever, like
Yeah.
your show notes and stuff. But basically, what they're all the KSLP, the Kaufman speech praxis test, something like that. That one was intuitive as well, and it doesn't necessarily you have to be careful with that one because she diagnoses everyone with apraxia in that test.
Mm,
It's either mild, moderate, or severe. But what it does give you an idea of is like, you go through all of the different syllable shapes, having the child repeat them, and you do find discrepancies like, oh, wow, how come they could say knee in a CV and then it was hi in a CVCV? Like, that's interesting.
mhm.
They should be able to say honey if they had it in knee.
Right.
So that test was really good and taught me a lot too. But essentially, a motor speech exam is you're having the child say words multiple times in a row, taxing their zone of proximal development. So, if a child can speak in multisyllabic words and you're like, say tie 5 times and they're consistent, you're not taxing the motor plan. We have to find where it's going to be really challenging. And then you will see, like let's say a kid was at let me give you Ashlyn's example. So I thought
Okay.
Ashlyn had dysarthria, and Ruth Steckel is an international expert who was coming to Denver, where I live, not giving a talk on apraxia, giving a talk on literacy. But I was like, she was one of my mentors in that training I was talking about, and I was like, please, 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 will you see her? So she agreed. So I, crazy mom, went to her hotel room, and first she just wanted to verify the apraxia diagnosis. But Ashlyn, by this
Mhm.
point, had had a lot of therapy, and she was pretty consistent in things that she was saying, and I was like, "How's she gonna do this?" So she starts with, like, ladybug. Say ladybug 5 times. Ladybug, 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 ladybug. She nails it. Say butterfly, nails it. Then she went into stethoscope. Say stethoscope 5 times.
Mhm.
Say microscope 5 times. Say statistical 5 times. Woo! There you saw it all come out. And so
Wow.
what we're looking for in that motor speech exam are there's an ASHA 3. So the top 3 characteristics for CAS that are an ASHA must have are inconsistent errors on repeated production of words. So you're going to see that in it
Mhm.
when you're taxing the motor plan if it's apraxia. So I give the example, if it's phono, let's say you have a severe phono kid too, and maybe their
Mhm.
representation of microscope is like mitotope. That would be a common way to say it if you have phono
Right.
disorder. But they're not going to say it inconsistently. They're just going to say mitotope, mitotope, mitotope. There's not going to be this like hard like struggle to get the word out. It's
Right.
going to be unintelligible to some people. But yeah, with apraxia, you're going to see likely inconsistent errors on those repeated production of words. The second criteria from ASHA is that difficulty with co-articulatory transitions, which really just means going from one sound to the next to one syllable to the next. And that'll show up when you do a motor speech exam that's taxing the motor plan. And then the third must have of the ASHA 3 is some sort of prosodic disturbance, some issue with prosody. So usually what we see is like equal syllabic stress. So instead of tomato, you might see tomato, or ladybug, you might see ladybug, ladybug, where it's
Uh-huh.
like they're still having equal syllabic stress. That's how we usually see it. But do keep your ears out for inability to variate their volume. Like that can be a thing where you go like
Mhm.
with a car, like wee. That could be really challenging for someone with apraxia. And then pitch, tone, things like that. But usually it's with the stress that we see it. So when you do your motor speech exam, you're going to be looking for those three. But then there's other characteristics. There's another great article that you could probably link in your show notes. I'll send it to you by Edith Strand. I think it was a
Mhm.
2017 called Appraising Apraxia. And in that one, she identified characteristics, additional characteristics that are becoming more discriminatory of childhood apraxia of speech. And she lays it out in a really clinician friendly way, I feel like, and has like charts and comparisons and things like
Yeah,
that. And
that's
so
what
other
I
additional
need.
characteristics. Yeah, it's really good.
Yeah.
Other characteristics would be like vowel errors or distortions, consonant distortions. Super hard
Mhm.
to give you an example of a consonant distortion, but if you're an SLP, you know a not clear substitution when you hear
Right.
one.
Mhm.
Yeah, so that's more discriminatory. But yeah, definitely look up that article. Very clinician friendly, super helpful.
That's awesome. I'm thinking back over my career, and I don't know that I've ever had a child that I've worked with that was officially diagnosed with apraxia of speech. But early on in my career, I'm thinking back to kids that I worked with, and I'm like, that was apraxia, and I
Mhm.
just didn't know it then. I didn't
Mhm.
know.
Well,
So,
and you there's good reason for that. ASHA only officially recognized childhood apraxia of speech as its own separate and distinct disorder in
mhm,
2007.
I
So,
knew that. Yeah, I knew it wasn't long. I mean, 2007 seems like a long time ago, but in my world, that wasn't really that long ago.
yeah, well, I mean, even me, I graduated from grad school in 2008. So, I didn't have any information even in 2008. I had
Yeah,
11 loose leaf papers maybe on childhood apraxia of speech.
yeah. Interesting, and that's what a lot of people don't understand. It's not really it's always been there, but it just wasn't recognized until 2007.
Yep.
Wow. What are some common misconceptions? I know there are a lot of
Oh, man.
misconceptions out there, and the first one that I can think of that I've had people tell me before is that it can't be diagnosed until a certain age. Is
I
that
was
true or
just
not?
gonna go there. Yeah. I've heard you can't diagnose until 3, until 5, until 8.
Mhm.
I've heard, like, all of those random numbers.
Yeah,
Really, age of diagnosis is not as important as if what's the most important is can they complete a motor speech exam? So, as you were just hearing me talk, if we want a child to repeat words 5 times in a row, what 2.5-year-old is going to be willing to do that? And even if they
right.
can do that, they're still toddlers. Like, who would
Right.
be wanting to do that? You do get
Yeah,
you do get an outlier, that girl with
right.
no ADHD that just wants to please you, that does everything you say. I mean, that happens once in a blue moon, but it's very unusual to be able to find a 2.5-year-old that's gonna be able to do a
Right.
motor speech exam. So, really, that's the main thing. So you can be and then the reason the 3 is the myth is because ASHA has in there I don't know if it's the technical report, but very much so in their portal that a diagnosis before 3 is tricky, and they're only
Mhm.
saying that for the reasons I just outlined. And so
Right.
they said, "If you suspect it, though, operate under a provisional label like suspected childhood apraxia of speech." So I think because ASHA put in an age, that's where that myth kind of tends to persist, like, "Oh, you can't diagnose until 3." So
Yeah, I'm thinking about a little one that I worked with about a year or so ago, maybe 2 years ago, who was basically I mean, I wondered if the child had selective mutism
They
because
can,
he
that's a comorbidity, but we haven't studied that as well yet.
yes, he had no words and would not even attempt. He wouldn't attempt to make a facial expression, um, and the motor we always forget about speech being a motor act, but just that gross motor imitation was almost nonexistent.
Mhm.
And mom had gotten on the internet, like you said, she had gotten on the Google, and she came and was like, "I think he has apraxia of speech." And I'm like, I don't know because he won't how am I gonna know if he has apraxia of speech if he has 0 words or 3 words that he says randomly, but when I ask him to say something or it's modeled, we're prompting, we're doing the things, and he's just looking at me. I mean, you can't diagnose apraxia of speech if they're not willing to try, right?
That's why a lot of autism parents get discouraged because they suspect that their children, have apraxia, but then when they find out we have to do a motor speech exam, we have to. That's why ASHA has a criteria now for diagnosis. If we just go after suspicions without any
Mhm.
diagnostic process. We can't do that. But what I will tell you is that if we suspect it, just as ASHA said before the age of 3, if you do suspect it, you do want to change your treatment plan to a provisional label of suspected childhood apraxia of speech. So, what would make us suspect CAS in a non speaking child that's not giving you anything? So, there's actually quite a few things that I only learned postgraduate and honestly with my own lived experience with Ashlyn. So, one of them right away, common in case histories. Case history, you dig deeper than you've ever done before with any other
Mhm.
child. I will tell you, you can gain so much from a case history. So, frequently reported in case histories for apraxia are right off the bat difficulty latching. Most of the time, it's concluded that the baby had a tongue tie, but did they? Because there's this theory that there's this like, what's it called? Suck, swallow, breathe. Whatever that pattern is, it's a
Yeah.
motor plan.
Yep.
So, right off the bat, you might see it there. Then by 6 months, we expect children to have reduplicated babbling. Ma, 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 da, 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 da. If you ask the parent, hey, did your child babble? They might say yes. Give them examples because then they'll be like, oh, no, 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 they never did that. Like they just made sounds. Super common.
Squeals. Yeah.
Yep,
Squeals,
super
oohs,
common.
ahs. Yeah.
Yep.
Mhm.
And then by 9 months, definitely, even if the parent says yes at 6 months, we have reduplicated babbling. By 9 months, most of them almost always say absolutely no variegated. They didn't hear jargon, variegated babbling. Like that's not in the
Mhm.
case history. And then other things, this is a big one too that I didn't know until I got in this field, pop out words. So this is different than autism where parents report they had language, 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 and it just stopped and then went backwards. Pop out words, the child's still talking, they're still developing language, but they have words once or twice that then disappeared.
Yeah.
Very common to have that reported in the case history. And so I ask all those questions during an evaluation. And if, every time the parent says yes, 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 it's adding to my body of evidence that this might be motor planning and I have more reason to suspect it. Just like you said with difficulty imitating gross motor, are there motor planning in other places of the body, like gross motor, fine motor? And a
Mhm.
big one that I like to ask is oral motor. So oral apraxia is difficulty planning and programming the movements not for speech, like non-speech oral motor movements.
Mhm.
So can we round our lips? Can we blow out a candle? Can we pucker for a kiss? Can we
Mhm.
round and retract our lips quickly? If
Right.
they have difficulty doing that without respiration and phonation, you're really suspecting apraxia.
Yeah.
Yeah.
But again, in that 2.5-year age, when you're looking at a 2.5-year-old, is it that they're not doing what I'm asking them to do because they can't, because they're not motor planning it, or are they just not doing it because they're like, "Well, I'm 2 and I just don't think I'm gonna
Exactly.
do that." And
Yeah.
that's where that misconception of an age of
Yeah.
diagnosis, I think, comes in. What are some of the biggest challenges that kids with apraxia of speech, face in just daily life? I mean, I don't think that we mentioned this, but you've mentioned Ashland a couple of times. So that's your daughter, and she was diagnosed with apraxia of speech. How old was she when she was diagnosed?
She was almost turned 3.
Okay. So what are some of the biggest challenges that children with childhood apraxia of speech face?
So I would say besides the obvious, which is just having difficulty speaking, communicating their message, behavior is communication. So you're going to see a lot of behaviors in these kids because if they
Mhm.
can't communicate, behaviors come up. But I think our audience probably knows that. I'd like to touch on some things that most people don't realize. And as I said earlier, it's a lifelong neurological disorder. And what really makes it more lifelong, more than anything, because you can have a highly intelligent person, not intelligent, intelligible person as an adult where you might not even think that they had apraxia, but internally, on demand speech is always going to be difficult than just casual speech. So you might have the child in your classroom who's talking with their friends, they're at recess, they're at lunch, there doesn't seem to be a problem talking, and then the teacher calls on them, think you're a severe ADHD kid who's always having like bursting out or whatever, having outbursts rather, and then the teacher calls on them and they don't answer and the teacher assumes they're being defiant.
Right.
That could be, but a lot of it could be this difficulty with on-demand speech. I volunteer for the Apraxia Foundation, and Jordan is the founder, and he has grown up with childhood apraxia of speech. And he tells the story of being in 3rd grade, and the teacher had given everyone their assignment, and he was capable of doing the assignment, but he was unable to ask a clarifying question, so he just sat there. And the teacher told him once to get to work, told him twice to get to work, and then sent him out in the hallway for the rest of the class since he was refusing to do his work. And only as an adult could he finally say, "A reason I wasn't doing my work is because I couldn't ask a clarifying question." So he literally got punished for his childhood apraxia of speech.
Wow. That is unbelievable.
Yeah.
Um, can But children who have apraxia of speech, I think you just answered that, they can eventually become intelligible, fluent communicators, correct?
Yeah, absolutely. Prognosis varies wildly, though, and for a variety of different reasons. So, absolutely, you see people who speak. You wouldn't even notice, you wouldn't detect that there was a speech disorder there, all the way to still non speaking using an AAC device.
Wow. What are the what are the most effective therapy techniques? What can we as speech language pathologists do? If we've got a child, we it's been diagnosed childhood apraxia of speech. Where do you start?
Right. It's so hard because I feel like every training helped me in incremental ways. It was like the more
Mhm.
trainings I took, the more I understood and the more I understood and the more I understood. It was like a gradual process into understanding apraxia. It wasn't just this like one light bulb
Right.
training. You know what I mean? So,
Yeah, I feel very ill equipped. I think if a child came in with to me with apraxia of speech, and I have one that I'm suspecting now, I wouldn't know where to begin.
yeah. So I can link some, we could put some more things in the show notes, but there is a course on childapraxiatreatment.org where you can get DTTC for free. It's like 7 to 8 hours of training and you don't have to do it all at once. You can just, keep coming back
Mhm.
to it. And you can get CEUs, and that's taught by Edith Strand, who pioneered it. So that's available for everyone and it's for free. And the reason it is because it's through the foundation. And that's what the foundation is funding, is training for SLPs to know how to treat, and at least that'll get you like a baseline of at least DTTC, which is an evidence-based approach for apraxia. All the evidence-based approaches for apraxia all have one thing in common: principles of motor learning and how
Mhm.
we apply principles of motor learning to the speech. So that can get you started. Another good one is on the Apraxia Kids website. Edwin Moss does a hour free introductory, he calls it like a gentle introduction to motor
Mhm.
learning. And so it's an hour and it gives you like an idea of what principles of motor learning are. So those two could probably get you started. But like I said, all the trainings help me. I love listening to Nancy Kaufman. That woman is brilliant. If you get a
Yep.
chance to attend a workshop from her, she's phenomenal as a clinician. Like she's more of a clinician, not like a researchy, so
Right.
I relate a lot to things that she says. And yeah, maybe start from there.
And what about frequency of therapy? Is it different for children with apraxia of speech?
Yes. So current research we had for the most part says 3 to 5 times a week of individual. 5 times to me, I don't tend to, recommend 5 times a week unless I'm dealing with a really profound case
Mhm.
and the child can participate in therapy that much. I mean, that's a
Right.
lot.
That's a lot.
Yeah.
Yeah,
So we
it's a
use
whole
our
lot.
clinical instincts on, when we're saying we recommend that. But there are researchers like, I always forget his last name, Aravind, though, up in Canada where that's not possible to get that much therapy for kids. So he's trying
Right.
to research ways that we can get parents involved and at only 2 days a week, and has had some success there with one research article that he published. So, but by and large, right now, the recommendation is 3 to 5 times a week of individual.
Right. Because repetition and practice, I mean, that's it, right? I mean, when you're dealing with motor speech, it's repetition and practice.
When you're dealing with motor anything, so think
Yeah.
shooting a basketball, playing a
Mhm.
piano, what is the thread that holds all that together that gets you better? Practice.
Practice.
Yeah.
Absolutely. Practice. What advice do you have for speech language pathologists that are listening to this? That because I think a lot of our listeners, some of them may not be as seasoned as I am and have been practicing for 25 years. A lot of them are in graduate school or recent grads with their master's degree. What advice do you have for them in working with children with apraxia of speech?
I think my biggest advice to grad students is to understand that no one expects you to be an expert in every speech and language condition from birth to geriatrics when you come out of school. And I only say that because for some reason I thought those C's meant that that's what I was, that I had
Right.
to be that and I had to
You had to
present
know
that way.
everything. Yeah.
Yeah, and it's just not possible, and it's okay to say, "You know what? Let me look into this some more." Like, or maybe I don't have enough knowledge in this. I will tell you, a parent will respect you much more if instead of pretending you know it all and you've got it under control, they will respect you so much more if you're like, "You know what? Let me look into that. Let me see."
Right.
Yeah.
Yeah, because there are people out there like you who are experts in the field and who would be a great resource for someone who's got a child on their caseload that has apraxia of speech.
Yeah, I do consultations all the time, not only for parents, but like they'll pull in their SLP, especially internationally. SLPs might not have experience either. And honestly, when you learn characteristics of motor learning, which some of the main differences that you're going to see in therapy is you're going to have cueing. So
Mhm.
cueing is any sort of cue, verbal, visual, tactile, that you use to cue the child with whatever sound sequence you're working on. So common cues that I'm sure your listeners have heard, like Biorum is doing a great job marketing her sound cue
Mhm.
cards. So like she has M as the yummy sound, and then she has an E. And so if you're cueing the child, you're gonna be like, start with your yummy sound, and then you're gonna show that the E. Good. Now put those together. Me.
Mhm.
In doing that, I just demonstrated simultaneous production. That's a characteristic. That's a DTTC strategy. Super effective getting that co-articulation. I had a kid with apraxia and autism, and I mean, the E was very strong. So I was like,
Right,
sing it, sing it. It's not E, it's me. And trying to use
right.
simultaneous production with those cards really helped. So you're going to be seeing and doing a lot of that, and that's different than phono. And then the other big piece of it, besides repetition, is performance feedback. So with performance feedback, we have to tell the child what they're doing with their mouth and what we need them to do. So for example, last night I had a kid asking for more, and he's like, ma, ma, ma. And I'm like, you said ma. We need you to round your lips, and I need you to say more,
More.
and really slowing him down. So that's performance feedback right there.
Yeah.
Those two
Yep.
big things are what you're going to be seeing as a different strategies being used throughout therapy for apraxia.
Wow. Laura, I've got a million other questions. Like, I could sit here and pick your brain for the next hour, but I know we don't have that time. I think that we've done a really good job of giving just a broad overview of apraxia of speech. I'm gonna recommend that we bring you back and that we do an episode on just evaluation and
Yeah,
what that
sure.
evaluation looks like, and then maybe bring you back again, and then again, and again, and again, and just go through everything. But I would love to have you back and talk just about the evaluation piece because I think that I mean, obviously, you've got to have a good evaluation to get going and get that diagnosis, and then what do you do? So, but I think we've done a really good job of just giving a broad overview, helping our listeners understand what apraxia of speech is, what you need to look for. And we're going to have all of those evaluations linked. If you will make sure that you send those to us, that would be
Yeah,
fantastic. Have all of the evaluations linked and any resource that you have. And
yeah.
then you guys go to TikTok and find SLP Mommy of Apraxia because that is where I found her. I have found so many of my guests on TikTok. So I love watching your videos. It's been great having you on the show. Thank you so very much for coming back.
I just want one final thought, if I may,
Yes,
to your
absolutely. I
grad
love it.
students. I just want to say, to me, the most dangerous thing about the field is that SLPs may think they know. And so if you think you know, how to treat apraxia, how to do AAC, and you have not gone to a updated continuing education course in that whatever you're treating, if you have not gone to an updated continuing course and just made sure you're still on track with the research, that's more dangerous than just saying, I don't know, let me go look into it.
Right.
Because this not only happens with apraxia, but this just happened with a client I had with AAC. She was fitted with so many people that were limiting the child's vocabulary, wanted her to just learn one thing before moving on to the next thing. And research now with all of my AAC, I'm not an AAC expert, but with all of my AAC expert colleagues, is we give the child access to a robust form of
Right.
communication. We don't limit the vocabulary. We're not
Mhm.
hiding folders so that they learn one thing at a time. That's not how we learn language in general. And it just made me think like, like this is exactly the problem. Like that's how I was taught 20 years ago how to use
Right.
AAC.
Mhm.
I haven't gone to an AAC course in how long? So anyway, that's my final thought on anything.
I love that. Make sure you know. Keep up with the research.
Yeah.
Go to the continuing education and give us the websites too, because you talked a lot about free trainings and free
Yeah.
webinars and free CEUs. So things that you guys can do on the weekends, listening in the car while you're
Yeah.
driving, maybe like listening to this podcast. So
Perfect.
Laura,
Thanks,
thank you
Michelle.
so much for joining us. It has been amazing having you on. And I do want to bring you back and do one just on evaluation.
Yeah,
So,
let's do it.
all right. Thank you so much. I hope you guys have a great day. Thank you for tuning in to SLP Full Disclosure. You can learn more about this episode and our show on our website at amnhealthcare.com. If you enjoyed this episode, share it with a friend and subscribe to our show on your favorite podcast platform. You can also find show updates and SLP opportunities on our Instagram at AMN Allied. Special thanks to AMN Healthcare for making this show possible. See y'all next time.